Let us now take a look at common neuromuscular conditions that you will encounter in physical therapy. Neuromuscular conditions can be inherited or acquired. So for example, one may have a gene for which they will inherit a disease, such as the case of Huntington's chorea, a devastating neurological disease. Examples of acquired neuromuscular conditions include those acquired from trauma, disease, or secondary to other disorders, such as polyneuropathy, which is associated with diabetes. All ages can be affected, ages birth to death, and these conditions can be either lifelong or temporary. Some neuromuscular conditions are reversible, some remain static, in other words, do not change over time, and some are progressive, meaning they worsen over time. Because neuromuscular conditions are usually lengthy, there is often extended contact with physical therapy. The first common neuromuscular condition we will discuss is a cerebrovascular accident, or CVA. This is more commonly referred to as a stroke. This occurs from disruption of blood flow to the brain. Disruption of blood flow can occur in one of two ways. A hemorrhagic stroke refers to a rupture in a blood vessel causing disruption of blood to the brain. You can see this depicted on your slide here. There was a ruptured blood vessel and blood leaked into the brain. An ischemic stroke refers to disruption of blood flow secondary to a blood clot in the brain. You see this depicted on your slide here, where there's a blood clot here, and then blood does not get to this area of the brain. Typically, hemorrhagic strokes cause more damage to the brain than ischemic strokes, but this is not always the case. Symptoms of a CVA are dependent on the area of the brain that is affected. Common symptoms include complete or partial paralysis on the opposite side of the body. This means if the blood flow is disrupted in the left hemisphere, for example, the complete or partial paralysis would be on the right side of the body. Other possible symptoms include left-sided neglect and expressive aphasia and/or receptive aphasia. Aphasia is a term that refers to communication disorders. It comes in two forms, receptive and expressive, and an individual may have one or both conditions depending on the level of injury. With receptive aphasia, the person has difficulty receiving information. So, for example, if you are speaking to them to instruct them in rehabilitation, they will not understand what you're saying. In this case, the use of demonstration may be necessary for them to understand the activity. With expressive aphasia, people have difficulty expressing information verbally or in writing. These people can understand you, but cannot express themselves well. Use of short yes or no questions is helpful when speaking with these types of patients, as they can nod to answer, for example. Left-sided neglect is a condition that results from a lesion in the right hemisphere of the brain. The person lacks awareness of their left side. So, for example, if the examiner places a pen in the person's field of vision to the right and asks them to watch the pen as it is moved to the left, once the pen reaches the midline, the person will stop tracking the pen. So in other words, they won't turn their head left to follow the pen. Another example is in the bottom of your slide, with the normal view on the left and the view of a person with left-sided neglect on the right. So here's the normal view, and here's the view that the person with left-sided neglect would see. The purpose of physical therapy with these types of patients is to facilitate functional recovery as best as possible, and to teach the person how to adapt with their residual deficits. Another common neuromuscular condition is traumatic brain injury, or TBI. A TBI occurs from a traumatic event, such as a motor vehicle accident, a fall, or violence. Shaken infant syndrome is also a result of TBI. You see on the slide a depiction of an individual being hit by a baseball and how the brain can then crash against the side of the skull as a result, as you see here. These injuries are often associated with fracture, dislocations, and lacerations to the skull, and the damage is usually diffuse. Trauma to the brain can result in neurological deficits including sensory, motor, intellectual, and/or emotional dysfunction. You see on the slide on the right-hand side a depiction of how axons can be damaged by twisting, stretching, or compressing from a traumatic injury to the head. And you see this here. This term on the slide, closed head injury, refers to damage to the brain without any fracturing of the skull. The age groups most often affected are children and young adults. An example might be a young man that crashes his motocross bike and suffers a TBI as a result. You probably have heard about concussions, as this issue is gaining awareness in the general public. Concussion is a form of traumatic brain injury, often suffered by athletes, in particular football, hockey, and soccer players. Treatment for individuals with TBI often requires a team approach, as there are often cognitive effects as well as physical effects. Spinal cord injury is a devastating injury to the spinal column that results in total or partial paralysis, depending on the level of the lesion and the extent of injury. Spinal cord injuries are caused by motor vehicle accidents, falls, and violent acts, such as gunshot wounds, diving headfirst into shallow water, and football injuries. Men ages 15 to 25 are most often affected. Again, deficits from such an injury are dependent on the level of the lesion, and the lesion means the damage, and the extent of this damage. For example, with a complete lesion, meaning the spinal cord is completely severed, the individual will suffer plegia. This means there is no function below the lesion, no movement and no sensation. If the damage is incomplete, meaning the spinal column was not completely severed, the individual will suffer paresis, which means there will be some sensory and/or motor function below the lesion. You see in the slide the distribution of deficits based on the level of injury, and you can see this here: C4, C6, T6, and L1. First, let's look at the lesions at T6 and L1 right here. You can see by the deficit distribution that this person has deficits only in the lower trunk and lower extremities, and that the upper trunk, neck, and on extremities are unaffected. The terms for such injuries are paraplegia and paraparesis. Paraplegia is the term used to refer to paralysis in the lower trunk and legs. Paraparesis is the term used to refer to some form of deficits in the lower trunk and legs, meaning the spine was not fully severed, so some sensory and/or motor function still exists. Similarly, the slide depicts lesions at C4 and C6 here. You can see by the deficit distribution that this person has deficits in the entire trunk, lower extremities, and upper extremities. The terms for such injuries, in which all four limbs are affected, are quadriplegia and quadriparesis, depending again on the extent of damage to the spinal cord. Immediate medical treatment following such a traumatic event is immobilization to the spine, either by internal or external means. Often surgery is performed to fuse the spine at the level of the lesion to stabilize the area and prevent further injury. Following stabilization, extensive rehabilitation is required to maximize function in the presence of the resulting deficits. Mobility in the joints must be maintained and strength improved so the individual can adapt and function at optimal level. This includes strengthening the unaffected muscles and working on cardiorespiratory capacity. In addition, adaptive equipment will be needed based on the level of the lesion. For example, an individual that suffers a lesion at C4 and is a quadriplegic would benefit from having a motorized wheelchair, as you see here in this slide. A paraplegic, on the other hand, would benefit from a non-motorized wheelchair, as they still have upper extremity function and can propel the wheelchair manually. An example of rehabilitation is seen here on your slide. In this picture, a man with paraplegia is learning to use his upper extremities to maneuver on the plinth. This is training for transfers, such as getting in and out of bed. You also see a brace around his trunk for stabilization. Another neuromuscular category of disorders are vestibular disorders. The vestibular system helps detect head position and movement and allows us to maintain our orientation in space, control our posture, and maintain balance. The system includes the semicircular canals in the inner ear, which are depicted here, and the connections to the vestibular nerve, vestibular nuclei, and various brain regions. Damage to the vestibular system can occur from trauma, toxicity from large antibiotic doses resulting from treatment of infections, and other pathological changes secondary to other disease processes. Symptoms include dizziness, unsteadiness, vertigo, and nausea. Vertigo means a sensation of moving around in space. Physical therapy can be effective in treating vertigo. For example, vertigo caused by loose bodies in the inner ear can be improved with positioning maneuvers as depicted here on your slide. Multiple sclerosis is another common neuromuscular condition in which demyelination of nerves occurs. The myelin sheath that covers nerve axons aids in nerve transmission, and with multiple sclerosis, this sheath is damaged. This results in disturbances in nerve conduction, which ultimately causes weakness, fatigue, alteration in sensation, and disturbances of eye movement and speech. The cause of this condition is unknown, and those most affected are women between the ages of 15 and 45. There are 4 forms of multiple sclerosis. The first, benign. This is where remission with no functional deficits occurs. What does this mean? Well, this means that a person suffers some symptoms, but they remit, meaning go away, and they never return. The exacerbating remitting form is a form where there are periods of worsening followed by periods of improvement. It is sort of a roller coaster of symptom development followed by symptom improvement. In this form, when remission occurs, the person regains their original level of function. The next form is remitting progressive. This is similar to exacerbating remitting, except that improvement after worsening is not as complete, and each episode leaves a residual problem or increase in problems, causing a general progression of decline. And finally, there is the progressive form. With this form, there is no remission. Symptoms steadily worsen, causing severe disability. Physical therapy treatment for this condition includes education based on changing function. For example, people suffering weakness from multiple sclerosis should try to retain strength during the exacerbation period. However, excessive exercises during this period is counterproductive, as these individuals can fatigue easily. So therefore, they need to be instructed on the proper amount of exercise. Parkinson's disease is a disease characterized by the death of dopaminergic neurons in the brain. This results in the characteristic symptoms of this disease: tremor, rigidity, and bradykinesia. Tremor occurs usually in the hands and feet when the body is at rest. So if someone is just sitting in a resting position, you may see tremors in their hands. Rigidity refers to a disturbance of muscle tone and resistance to passive movements. What does this mean? Well, if you were to try to move the limb of a patient with Parkinson's disease, the limb would not move smoothly and it would feel rigid and firm in resisting the motion. This is not under voluntary control, but feels like the patient is trying to resist the direction in which you are moving their limb. Arm wrestling would be an analogy, what it feels like to arm wrestle someone. Bradykinesia refers to slowness of movements. People suffering from Parkinson's disease have a hard time initiating movement, and movements that do occur are very slow. The cause of Parkinson's disease is unknown, and it got its name from James Parkinson, who first described the disease in 1817. In your slide, you see Muhammad Ali and Michael J. Fox. These are two famous people that suffer the disease. Physical therapy treatment includes educating the patient and family on the problems to be expected and how to compensate to maintain function and prevent and minimize further problems. Amyotrophic lateral sclerosis, also known as Lou Gehrig's disease or ALS, is a severe and lethal neuromuscular condition. Lou Gehrig is depicted in your slide here. He is a famous New York Yankee baseball player that suffered the disease. Anyway, this disease is rapid and progressive degeneration of motor nerves. These are the nerves that allow voluntary muscle contraction. So with degeneration, there is a progressive loss of strength to the point of paralysis. The median age of onset for this condition is in the 50s, and the cause is unknown. In addition, there is no cure, and the survival rate is low, with the average rate of survival 4 years from diagnosis. Some have survived much longer, however, such as the famous physicist Stephen Hawking, as seen here. Dr. Hawking suffers from a rare, early onset, slow progressing form of ALS that he has suffered for decades. Physical therapy treatment includes educating the family and caregivers on patient handling, and also consultation on the use of adaptive equipment and the preventative and supportive care for secondary problems of muscle weakness, such as respiratory infection.